Hello and welcome. Malaria has been battling humanity for literally millennia. It's a brilliant, shape-shifting opponent. But guess what? We have an arsenal of our own. Today, we're diving into the ingenious strategies we use to hunt down and destroy this microscopic killer. Let's get right into it.
Really think about that. It is a massive challenge, right? This isn't just some simple germ we're talking about. It's a parasite that can hide in our liver, it can invade our red blood cells, and it is constantly changing its tactics. But thankfully, our weapons have evolved too. So let's explore the different ways we take the fight directly to this parasite.
So, here's our bottle plan for today. We're going to break down 3 of our most important weapons, everything from siege tactics to special ops. We'll look at how they work, and then we'll see how these incredible strategies are deployed right on the front lines of patient care. To get started, I want you to think of this less like medicine and more like a military campaign. You'd never send in just one type of soldier for a complex mission, right? You need a diverse army, each with different skills. Well, the exact same thing is true for fighting malaria. And that's the key right there. There is no single magic bullet. Instead, we have these different classes of drugs that target the parasite at different stages of its life cycle and through totally different mechanisms. So let's meet the first platoon. First up, we have the antifolates. Now, if we're sticking with our military analogy, these are the siege experts. Their strategy isn't some big frontal assault. Nope, it's all about cutting off the enemy's supply lines and literally starving them out.
So what's the one crucial supply line they target? It's a nutrient called folate. You see, the malaria parasite desperately needs folate to build its DNA and to replicate. So by cutting off that folate supply, we stop the production of any new parasites right in its tracks.
The way it works is actually pretty elegant. The parasite tries to make its own folate, but our drug gets right in the way, blocking a critical enzyme. This just stops DNA production cold. The parasite's invasion grinds to a complete halt. It's fascinating stuff. Now, these supply line cutters are so effective that they're actually used against a whole range of other invaders, not just malaria. And to help you remember where they're deployed, there's a really handy mnemonic. All you gotta do is remember STPS. S is for skin infections, T for toxoplasmosis, E for E. coli, P for a specific type of pneumonia that we often see in immunocompromised patients, and another S for certain streptococcal infections. A seriously versatile tool in the toolbox. But of course, every weapon has potential risks, and it is absolutely critical to know what they are. For antifolates, the side effects can be remembered with another helpful phrase. And that mnemonic is sulfa rashes. It covers a whole range of potential issues. The main takeaway here is that while these drugs are incredibly powerful, they can cause problems, everything from skin rashes to more serious effects on the kidneys and blood cells. It's just a good reminder that every powerful weapon needs to be handled with care. Okay, so if antifolates are the siege experts, what's next in our arsenal? Well, meet the special forces, the 8 aminoquinolines. These are the assassins we send in to take out a very specific, very hidden enemy. Their mission is totally unique. They target the dormant sleeper forms of the parasite that hide out in the liver. These are the little guys that cause malaria to relapse weeks or even months later. So these drugs are absolutely key to achieving what we call a radical cure. And how do they pull this off? It's amazing. They turn the parasite's own internal environment against it. They generate something called reactive oxygen species. These are highly unstable molecules that act like tiny little internal grenades, causing massive damage and killing the parasite from the inside out. So how do we know when it's time to send in these assassins? Well, every good special ops mission follows a clear PLAN. P is for the prevention of relapse. L is for targeting that liver stage. A is for use in active malaria, but, and this is important, only after the initial blood stage infection is cleared. And N stands for not for severe P. falciparum malaria, which needs different drugs. Now, with these special forces comes a really important safety protocol. Before you can even think about deploying this weapon, you have to run a critical check. And that check is for something called G6PD deficiency.
See, for people with this genetic condition, these drugs can be pretty dangerous, causing their own red blood cells to break apart. It's a condition called hemolysis, and it's exactly why testing for G6PD status before using these drugs is absolutely non-negotiable.
All right, finally, we have our rapid response team, the endoperoxides. If the other drugs are about siege warfare or stealth missions, this class is all about overwhelming force. This is the shock and awe campaign. Their mechanism is both ingenious and devastating. The drug gets inside the parasite and just waits. Then, the parasite digests our hemoglobin, and a byproduct of that meal, called heme, acts like a trigger, activating the drug. This unleashes a massive storm of those free radicals, the same internal grenades we saw before, killing the parasite with incredible speed.
So let's just put this in perspective for a second. Both the endoperoxides and the aminoclinolines use the same weapon, those destructive free radicals, but they have completely different missions. Endoperoxides are for the active war happening in the bloodstream, while the aminoclinolines are for hunting down those sleeper cells hiding in the liver. Different targets, different triggers.
Okay, so we've reviewed the whole arsenal. Now, how does all of this translate from the lab into the real world? How do we take this knowledge and actually use it to help patients?
So what does this all mean in practice? Well, for doctors and nurses, it's about being vigilant, monitoring for side effects, and, like we stressed, always checking that G6PD status before deploying our special forces. For patients, it's about discipline. You have to complete the full course of treatment to make sure every last parasite is gone, and it's about remembering that this is a multi-front war. The drugs are crucial, but things like bed nets and repellents are still our essential first line of defense.
And that brings us to our final critical question. The parasite is constantly evolving. It's developing resistance to our best weapons, learning to pump them out, or change the very targets we attack. So the ongoing challenge is this. Which of these strategies will still be effective in the future? And what new, innovative weapons will we need to develop to stay one step ahead in this ancient ongoing war?